Okay, so now we'll be talking about Clostridium perfringens. Clostridium perfringens is basically a gram-positive spore-forming obligate anaerobic bacilli. What it is? Gram-positive spore-forming obligate anaerobic bacilli. Okay, and this basically causes gas gangrene. So whenever you get a long question, it will be on gas gangrene. Next thing is Clostridium perfringens basically has capsule unlike its other Clostridia counterparts, and it basically it is a large intestine commensal. First of all, one thing to be noted over here is, and it causes gas gangrene, which is known as rapid edematous myonecrosis. Okay, and for an individual to contact for having myonecrosis or gas gangrene, some prerequisites are there. For example, since it is an anaerobic bacterium, so there should be anaerobic environment. And how will be the anaerobic environment provided? If there is crushing injury of muscles, for example in RTF, which causes laceration of arteries, or an open fracture of long bones, for example bullet injuries, or any devitalized tissue. Devitalized means cut off nerve supply and cut off blood. Okay, and next is contamination of the wound. Obviously just anaerobic environment won't be enough, that needs to be contaminated by the clostridial spores. Okay, now how does basically Clostridium how does Clostridium basically causes myonecrosis? It causes myonecrosis because of something known as alpha toxin. Okay, so this alpha toxin, what it does is, alpha toxin basically activates the GP2B3A receptor present on the platelet. It is responsible for platelet aggregation, as we all know, and CD11B and CD18 on neutrophil, which also causes leukocyte adhesion. So these two, the activation of these two, basically these three receptors causes adhesion and aggregation of platelet and neutrophil, and it will eventually lead to occlusion of the blood vessels, and occlusion will lead to cut off in the blood supply, anoxing muscle, and it is infected with clostridial spore, so that spore will grow and it will cause myonecrosis, right? Alpha toxin is also known as lecithinase. It is a phospholipase basically. This also has a inhibitory effect on the myocardial contractility, and obviously now you think, if the contractile power of the heart is gone, that means it will not pump enough blood and it will cause hypotension, further aggravating the low blood supply. Okay, also along with that, there is something known as theta toxin in the Clostridium perfringens, and this theta toxin causes vasodilation. Now you think, occlusion along with myocardial contractility ka dysfunction along with vasodilation, it will lead to severe hypoperfusion and it will lead to anoxia in the muscle, and that will eventually lead to production of lactic acid, creating more anaerobic environment, and it is already infected with clostridial spore. So eventually what will happen? There will be necrosis of the muscle. It will be very rapid and it will show edema around, and this is what we call as gas gangrene. So gas gangrene, Clostridium perfringens, is the most common and established cause of gas gangrene. But there are few other causes also. Few other established causes include Clostridium novae, Clostridium septicum, and some probable agents are, as you can see over here. These are not that important. You need to remember these three. Okay. Next, Clostridium perfringens can also cause hemolysis, and first of all, we have talked about gas gangrene, right? So how will a patient with gas gangrene present to you? The patient will present with sudden onset of excruciating pain at the affected site. So the patient will be like, Doctor Sir, dard kam hi nahi ho raha hai. There will be rapid development of a foul smelling, thin, serosanguinous discharge. Okay, there will be very foul smelling, and it is a very bad kind of discharge. Actually, when you go in surgery wards, you'll see it. Next, there will also be gas bubbles in the muscle plane, okay, which is it will give pop sound sort of. There will be extensive edema and induration, and eventually gangrenous tissue actually becomes liquefied and it slows off also. Okay, and eventually because of hypoperfusion, and there you suppose Clostridium is infecting, it is further depressing myocardial contractility. It will lead to septic shock, so there will be shock and organ failure, and eventually it will lead to higher mortality rate. It's not gas gangrene, but I've seen a case of venous gangrene, and that patient actually eventually died, and it is one of the patients which I presented in my surgery and posting viva, and that's very near to my heart, weirdly. Okay, we'll talk about that later. Anyways, Now, Clostridium perfringens can also cause certain symptoms in the gastrointestinal tract. What it can cause is, it can cause food poisoning, enteritis necroticans, necrotizing enterocolitis, and gangrenous appendicitis. Okay, before seeing, let us see how will it cause GI manifestation. If food which is cooked has been left standing for too long at less than 60 degrees Celsius and it is heavily contaminated with spores, what will happen is this bacteria will now, it is in spore, that means it is in the rough and tough situation. Now it is getting favorable situation, so the bacteria will start growing, so there will be vegetative bacteria, okay, and that will eventually release heat labile enterotoxin, okay, and within 10 to 12 hours of food intake it will lead to food poisoning symptoms, okay, and this is basically by the type A of the type A category of the Clostridium perfringens bacterium, okay. This basically causes food toxin and food poisoning, sorry. And how do we diagnose it? In the feces we can basically detect enterotoxin by the immunoassays available, and food poisoning is such deadly, it can even lead to pores in the intestine mucosa and it can lead to perforation and stuff also, eventually much later, but usually it is self-limiting and it resolves in 24 hours. Patient does not usually go into that extreme stage. Next is, it can cause enteritis necroticans due to beta toxin, the type C of bacterium, and it basically causes enteritis necroticans means inflammation of the inflammation of the intestine, and necroticans means necrosis, and this is the most common manifestation of jejunum. It can also cause necrotizing enterocolitis, basically in the colonics type side, and this is also caused by type A bacterium, and it can also cause gangrenous appendicitis, okay. Also gas gangrene is also associated with colonic malignancy, this we did not discuss. Gas gangrene, basically the spores and not the spores exactly, the bacterium can spread via hematogenous spread and it can seed into the colon, causing colonic malignancies, and this is more associated with Clostridium septicum compared to Clostridium perfringens or Clostridium novae. Also, one thing to be seen over here is there are 3 types in which this can manifest. Clostridium can basically cause simple cellulitis, anaerobic cellulitis, or anaerobic myositis, and in all the 3 there is contamination of the site of infection. The facial plane, the fascia, which we have talked about in anatomy, the fascia are affected in anaerobic cellulitis and anaerobic myositis, and in anaerobic myositis, as the name only suggests, myositis, the muscle will also be infected, okay. Okay, before beginning to lab diagnosis, let us talk a bit about the virulence factor, which I've been talking alpha beta. We talked about alpha beta toxin. There are 4 major toxin and 8 minor toxin. Major toxin include alpha, beta, epsilon, and iota, and minor toxin include gamma, delta, lambda, kappa, theta, eta, and mu. And there is also heat labile enterotoxin, which we talked about, which causes food poisoning, and some other substances produced, for example, are neuraminidase, histamine, bursting factor, and circulating factor. These are not that important. You must remember alpha, theta, and beta, okay. Why? Because alpha and theta we discussed, that causes myonecrosis, and beta causes enteritis necroticans, okay. And now talking about the incubation period of talking about gas gangrene, incubation period for Clostridium perfringens is about 10 to 48 hours. For septicum it's about 2 to 3 days, and for novae it's about 5 to 6 days, okay. So this is after which the patient will start come to you with symptoms. Now, once you have suspected a patient with Clostridium perfringens with gas gangrene, we have to send we have to get it diagnosed, like we have to confirm it by the laboratory, right? So how will we get it diagnosed? Is we take the specimen, preferably the necrotic tissue, and as soon as we take, one thing we should remember very very clearly, as soon as you take specimen for any anaerobic bacterium, you immediately put it in RCM broth, okay. This is basically an infusion broth. It provides anaerobic medium. You just need that, there should be no interaction of oxygen at all, okay. So basically you take specimen which we take is necrotic tissue, muscle fragment, or exudates from the deeper parts of the wound, and we immediately put it in RCM broth. After that, we send it to the lab, and in lab we can do direct microscopy, in which Clostridium perfringens will show thick, stubby, box scar shaped gram-positive bacilli without spore. Okay, in microscopy without spore, direct microscopy. This is how the bacterium appears. This is for Clostridium perfringens, but we know gas gangrene can also be caused by septicum and novi. In septicum, there will be citron bodies. Okay, these are boat or leaf shaped pleomorphic, irregularly stained bacilli with spores, and novi will show larger rods with oval subterminal spores. Okay, larger rod with oval subterminal spores. Okay, fine. Next, we can also do culture in anaerobic medium. For example, Robertson cooked meat broth, which is RCM broth, egg yolk agar, and we incubate it anaerobically. How do we create an anaerobic medium? By gas pack or axonomat. We know that palladium, hydrogen, and all that stuff, you need to revise it from general microbiology. Culture, we do it for 2 days in the anaerobic medium at 37 degrees Celsius. Now, after we culture it, we can also identify it further. How? In blood agar, basically this will show double zone hemolysis. Why double zone hemolysis? Because the theta toxin causes more intense hemolysis, and that causes the central more hemolytic zone, and the peripheral zone is basically caused by the alpha toxin, which is comparatively a weaker toxin, a weaker hemolytic toxin. So basically there will be a double zone hemolysis. Also, if we grow it in egg yolk agar, we can see something known as the Naegler's reaction. This you should remember from this chapter, Naegler's reaction, which basically in the egg yolk agar, when we the streak line is there, surrounding streak line we basically see opalescence, as you can see over here, this thing. You see, this is the streak line, and this is the opalescence near the streak line. The clear area is the opalescence, and the dark area is the streak line. Okay, and this is because of the alpha toxin. Okay, next it also shows reverse cam test. What is reverse cam test? Basically, we take the blood agar and we basically streak Streptococcus agalacti and Streptococcus perfringens perpendicularly, and since over here both of them are sort of meeting, so there will be more hemolysis near to the perpendicular. So this is reverse cam test. This will be seen in the blood agar. We can also see heat tolerance test in the RCM broth. We can grow the bacterium at 45 degrees Celsius for around 4 to 6 hours. This is the heat tolerance test. And in litmus milk, it will show stormy clot reaction. It will show turbidity in the litmus milk. Okay. So now, next, moving on to the treatment. The most crucial step is early surgical debridement. You need to remove the necrotic tissue and clear it off as soon as possible, and we should not close the wound immediately, because there is risk that we never know if the site is free from infection, right? So we take some time until we basically close the wound. Next, we can also give antibiotic. Basically, we give penicillin plus clindamycin for 10 to 14 days. We can also use hyperbaric oxygen. Now, you only think this bacterium is anaerobic. If we give the bacterium oxygen at a very, very high pressure, it will basically get killed. Okay, so we give hyperbaric oxygen, and we can also give passive immunization with anti-alpha toxin anti-serum. That's not that effective as far as my knowledge goes. So I guess we have discussed all about Clostridium perfringens. So what did we talk? Clostridium perfringens is a gram-positive spore-forming bacterium which has a capsule around it. It is normally a large intestine commensal. It produces certain toxin and causes gas gangrene, and also can cause gastrointestinal symptoms, right? So alpha toxin and theta toxin are responsible for myonecrosis, and different toxins are responsible for food poisoning. Okay, and we saw about the manifestation of the gas gangrene. We saw the lab diagnosis, from which we have to take out that it is the Naegler's reaction and the target hemolysis. Reverse cam test, litmus milk is basically what we should remember. And we also saw about how simple cellulitis, anaerobic cellulitis, and anaerobic myositis are different. We also saw one thing to remember, which might come as a MCQ, is that Clostridium septicum basically causes hematogenous seeding and is associated with colonic malignancy. And then we saw the treatment: early surgical debridement, penicillin plus clindamycin, hyperbaric oxygen, and passive immunization. I hope you all understood. Thank you.